So hi, everybody. Well, Margaret's working out the technical side of things. I just, so you know, this is the first time that we're actually doing this activity with breakout rooms. So it can be technically challenging. And I salute Margaret for her perseverance in getting this all set up. So I will buy some time and just go over just really quickly what we talked about on Friday. We went through kind of basic suicide prevention. We did some warning signs, risk factors, those kind of things. And then we actually went into, how do you begin to set up a postvention program or policy or protocol. We talked about some of the best practices involved in setting up a postvention plan, certainly safe messaging and some of the do's and don'ts, if you will. We did record it, so if you haven't had a chance and you're new today, you might want to go in and review it, especially if you're going to participate on Wednesday when we begin to create the plans. I'll take some time at the beginning of Wednesday's session to kind of bring you to speed on some of the slides we saw on Friday. It's really important that that we get you all into groups on Wednesday that have a really good understanding from a local level, so you're all kind of from the same town or from the same region. But more importantly, come away with today's exercise knowing that how important it is, not just for a certain segment of the population, but as the community as a whole in responding to a suicide death, using good, solid, best practices when it comes to postvention. So today's activity is going to I'm hoping today's activity will get you kind of excited and engaged based on what we learned on Friday, but also setting the stage for Wednesday as we begin to do the hard work. And I say that not lightly. It's not easy to do this kind of work as you build and create a plan. I'll have several templates for you or things that other towns that are using currently, which I have gotten permission to share with you, so that quote unquote we're not reinventing the wheel. The key thing is to really the activity to really get a breadth of understanding and how suicide affects a community as a whole and how we respond to it. So I'm really looking forward to that. And as you see, it's investigating the roles, and you're all going to be in a particular role today in your subgroup, and we're going to go to, I'm going to read this suicide scenario together. And when you break out into your groups, your group facilitator also has the suicide scenario. So if the group facilitators need to reread it, it's fine. What the breakout group folks are going to do with you is in those breakout rooms, you're going to have a role of an individual person that represents a part of the community that's connected to this scenario, and the facilitators are going to ask you 3 questions, and you think quietly about it and kind of write it down on a piece of paper if you want, that kind of thing, and then after a few minutes, your facilitator will then open your mic so that you can have a group conversation for about 15 minutes. We don't want to take too long here, about 15 minutes. And so when we come back as a full group, the facilitators will report for about 2-3 minutes each on just what you which your group and your particular person in your group was all about. We will also put in on the slide, we will show that particular individual's part of the scenario, and you'll see when we get there. And as we read all 10 of the individuals that were impacted by that suicide loss, we will reconvene in your groups. And the facilitators will then open to discussion about, now that you've heard the rest of the groups, what things would you do differently? Who would you be most concerned about? And over the next 3, 5, 6 months, how would you prepare your community? How would your so-called postvention plan or protocol or policy grow based on what you learn, or created as basis as you learn? And then a wrap up. We won't have the groups report back after it. It's really about having open conversations. And so depending on time, if we got more time, we'll allow you to stay in kind of that second round of your breakout group, so that everybody has the has an opportunity to share and the thought, and hopefully that group facilitator will be able to record your comments and such, so that you'll have them for future reference. So that's what we have planned today. It's going to take pretty much all of the rest of our time, so we can stay on task and the technology cooperate with us. I think you're going to really enjoy the exercise and really bring home why post-vention planning is so important. So how are we doing, Margaret?
Well, we're going to see how this works. So everybody, hi, I just want to say that, you know, I had a nice spreadsheet uploaded into Zoom, putting you guys into 10 different breakout rooms and with a facilitator in each one. And the spreadsheet is up, and it's been there since yesterday, and it's not working. And so I have been able to assign facilitators to different breakout rooms, but I'm not 100% sure this is gonna, that when I assign everybody else, that it's gonna quite work out. So here's the instruction. In a minute, I'm going to put everyone in breakout rooms, and facilitators, can you just take a mental note of what I'm about to read? I'm gonna put you in, it might not be the same room assignment you had before. So I'm gonna read you a number of facilitators. If you don't end up in that room, you should be able to put yourself in that room, or at least like send me a chat or something and say I'm not in the room, and I'll be monitoring that, because I want to make sure everyone gets into their room with a facilitator. Danielle, I want you to end up in room 1, Danique, room 3, Kevin, room 2, Christine, room 4, Gillian, room 5, Jeff, room 6, Jess Champagne, room 7, Megan, room 8, Larry, room 9, and Madeline, room 10. I think it's gonna work. Everybody else, you're gonna end up in a breakout room, no problem there. You just need the facilitator to come in, and we need to not have 2 facilitators in one room. Each room needs their own facilitator. So hopefully this is gonna work. You will be in your room for about 20 minutes. The facilitator will monitor the time, read you your assignment, and walk you through your questions. And then we'll come back to the main group, okay? So.
Before you hit that button, Margaret, let me read the scenario, the overall scenario, and then you can go ahead, hit the button, and put everybody in groups, okay?
Yep.
So here's the scenario. This is a late Sunday morning scenario where a gentleman named Joe Williams is a local primary care doctor in private practice. He's active in his church. Joe's the father of 3 children. He has helped his son's high school basketball or baseball league and Boy Scout troop. He's also involved with his daughter's middle school soccer team. Joe also has a daughter who is a freshman in college. Joe's wife, Sarah, is his college sweetheart. Sarah is the president of the high school PTO. Joe has been involved with other community activities, and the family is well known and well respected in the community. Joe and his wife, Sarah, have celebrated the upcoming Christmas holiday by attending a local gathering on Saturday night where they socialize with many prominent members of the community. This has been a tradition for them since they moved to this town 15 years ago. On Sunday morning, Joe indicated to his family that he did not feel well. So they attended church while Joe stayed at home. Upon their return back home, they learned that Joe has taken his life. So now you will go into your rooms and the facilitators will read the person or the scenario person connected to this overall scenario and how it relates to this. Great. Welcome back, everybody. Thank you for being patient. It's always interesting when you learn new things, as we are today. So thank you again for patience. We're going to read each of the 10 members of the community now. I'm going to go to each slide that represents that individual story. So if you are the facilitator, unmute yourself and report back. So here's the first one. Joe's wife, Sarah.
So just jump in.
Yep. Hi, Danielle.
Okay. Hi. So we were talking about how
wait, sorry, Danielle, sorry. Please first read the scenario because everyone else has not read it. Yeah.
Okay. So
read it and then just give like the highlights. You know, you get basically 2 minutes total.
Okay. So Sarah is the wife. She is experiencing a lot of shame. I'm in shock and devastated by my husband's death. Joe has not been his usual upbeat self for the past couple of months, and I thought it was due to his multiple responsibilities, including increased care for his elderly father. But last night when we drove to the annual holiday party, he did seem more upbeat about the holiday and all the kids being together. I'm not sure what to do next. I'm also very upset with the way that the police and the EMTs entered my home and conducted their investigation into my husband's death. I found them to be abrupt, especially when I asked them not to share with others that Joe took his life. The police indicated that they would not be able to do this. I'm worried about my children. I'm concerned what people will think of my family and me. I should have known. I should have seen this coming. Okay, so we said initially, we would contact the people who manage funerals because they would be resourceful and they would know all the aspects related to caring for that process. We also would connect with the school counselors and our close-knit community, maybe very close people in the church or peers on the PTO who might be close, who might be offer a level of support. Also, given that the father, he was caring for his elderly father, we know that we would need to find supports for the father now that his son would not be there to take care of him. What are the 1 or 2 things we do next that's related to the funeral people? And I just want to make sure. Yeah, those 2 answers were tied in with the supports. So but also we just make sure that the kids are okay. So the feelings, shame, guilt, initial shock, numb, surprised, might be deteriorating weeks later because the autopilot that was motivated initially would feel let down and abandoned, exposed because of the manner of death, and knowing that this would be out in the community, especially when she asked the first responders not to share the manner of death. So just perhaps disappointed that the husband left her, and just really ashamed that she didn't see it coming, and just struggling with those feelings of not knowing and not being able to predict, given that the husband was obviously possibly overcompensating because he was upbeat, that family was together and enjoying the holiday, and just struggling that they went to their service while he was, in moments of despair. Sure. So that's it for the 2 minutes, I think.
All right.
Yeah, great. And if you could see, related back to our training on Friday, these are very common things that happen when an untimely death occurs. So nice work, committee. Okay, Joel, the boyfriend. Who's that group facilitator? Unmute yourself. We know who that was.
That's
Oops.
Madeline Mantilla.
Oh, the boyfriend is the second one. I thought that I was the 8th position. I'm a little bit.
Or that was, yeah, that was just that was when the group numbers changed. You were supposed to stick with your same role. I think that's when I came into your group to say that. So did you guys do a different role instead?
No, we went back to Joel, to the boyfriend, and discussed briefly,
yeah.
very short, but I will read the
Yeah, thanks.
boyfriend. I am Joel, the boyfriend of their 19-year-old daughter, Suzanne Williams. I have been dating Suzanne for the past 2 years. I dropped Suzanne off from college for the holiday break. 2 hours after I drop her off, Suzanne texts me with the news that she found her father hanging in the basement. I was on Facebook when I got the text, and I quickly posted a message about her father's death before heading to Suzanne's house. I was afraid to go in. It was a crazy scene. So I sat in my car outside her house for 2 hours. So some of the things that we discussed, and I was trying to go back to the questions. It was who should contact first. It was discussed on the group that the boyfriend should text the girlfriend first to find out how he could be a support for the family. Also, he could share the news with his own family to have his own support. And also to the close friend that could be a support for them, since he has been with her for the last 2 years, seems like a steady boyfriend. Things that he should do when one or two things that he should do when this happened, it was to delete the post, since the group believe it's inappropriate to share that sensitive information about without consulting the family first. They should consult with the family and be a support for the family instead of sharing that sensitive information online. Another thing that he should do was to contact the people who probably share that information when it's online, to also ask them to delete that information before the family will keep getting contact. And how he feels seems like, according to the description, he was sad outside. He could be probably afraid, sad, overwhelmed with this sudden news, and also impacted about how it's going to be the future with the girlfriend. I think my 2 minutes are already done. I'm sorry.
No, very, very, very good. Thank you. A couple points here. And if you remember back to our Friday training, social media is a real issue and a real problem. And why in the postvention committee that you have somebody assigned so that somebody that has just experienced a tragic loss might not be able to manage reducing and cutting and communicating, and so having somebody neutral who understands, who's trained in safe messaging, I think is really important, and why it is where it is. And obviously, when you've suffered a loss like that, it's really hard to think clearly when you're in that moment of traumatic. But great work, thank you so much, man. Let's go on to the next group. Police officer, local police officer, that person facility report that.
I'm here. Yeah, can you hear me?
Yeah, hi, Kevin.
Hi. So the local police officer, I'll read the description here. I am the local police officer, and I have known Joe Williams and his family for many years. I talked with him and his wife, Sarah, at the party last night. Although I have responded in the past to other suicides, as well as horrible accidents, when I arrived on the scene and discovered that Joe killed himself, I was extremely disturbed and sick to my stomach. EMS dealt with the family while I conducted the death investigation with the deputy medical examiner. I confirmed with Ms. Williams that it was a suicide, and after briefly offering my condolences, I quickly left the city. I returned to the police station where I felt numbed out and just wanted to be left alone. So in answering the question, who do we need to contact? So we had questions about the HIPAA guidelines, but started to run through the various people that the doctor, the family were involved with in the town. We talked about contacting the medical examiner, and for our own personal well-being, contacting either the supervisor, union rep, or EAP, just to get the counseling that the officer role needs. Kept coming back to the, just making sure that the family was in a okay space. So making sure that the cleanup efforts, if there were taken care of, and that there were no reminders at the scene, and that the family had a safe space to go to. They couldn't be in the house. And then next, also if there was a postvention team in place, to deploy that team, contact that team. In terms of who to reach out to next, again, following up with the family. I think as it was mentioned on Friday, this is the family's information to share. So make sure that they're comfortable with anything that's going out and any contacts that are being made. And also, again, contact the EAP right away, or get the counseling and emotional support the officer needs for being in that situation and responding to this. In terms of what is the officer feeling? There's a lot of depression and shut down, guilty and overwhelmed by the circumstance, maybe a little bit of a regret having talked to the doctor for a while at the party the night prior, and not being able to, feeling like they didn't notice something or be able to step in and stop it, and shocked.
Great. Thanks, Kevin. Excellent report from your group. And certainly you guys had really good conversation. Just quickly to know, back again from our training on Friday, that even if the suicide death is pretty evident, it might not be, and why it can be really difficult for those who have just experienced a traumatic loss like this, especially when a death has occurred in a home. So your group was right on about bringing resources, making sure the police officer had all the resources and things. But just know when there is a death, an untimely death, it might take a couple of days, even though it's pretty evident that it's a suicide loss. But it's not official until the chief medical examiner's office rules it that way. That's the way it's done here in Connecticut. So, but you covered it really good. Thank you so much for that. Let's go on to the next one. The college resident advisor.
This is Jess.
Hi.
Hi, Jess.
So I am the residence advisor for the dorm at Suzanne's college. I got a call from Suzanne's roommate that she had a text from Suzanne that her father died by suicide, and she found him shortly after she had returned home from the holiday break. I sent an email to the residence director to tell her what I knew. I suggested that we deal with this when the students return in 4 weeks, as not to disrupt the holiday break.
Oops, sorry.
So in terms of who to contact, I think first we were sort of talking about reaching out to the student and the surviving parent to sort of get permission of who to contact, who they want to be in the know. Also simultaneously trying to figure out if there's a protocol in place already naturally. We talked about the residence advisor being another student. So realistically, it would be the resident director that would be following the protocol and sort of following up and really trying to piece out what the RA's specific role would be, which more is like the touch point for the student directly or possibly the roommate. So we talked about maybe calling the roommate because they were the one that gave the information and checking in with them on how they're feeling, reaching out to the roommate's parent to let them know. And then with the other students, Suzanne's permission and her parents' permission, that sort of going through if counseling services or the religious services on campus, possibly her academic advisor, if there wasn't a protocol in place, that these would be people that we would sort of want to be in the know, even if it was just that Suzanne had a death in her family or Suzanne's father passed away, without the details of exactly how he had passed away. So what to do next? We talked about not putting any of this off for 4 weeks and trying to get a plan in place sooner, because by the time 4 weeks pass, that's already too late to show your support. And really just knowing what the school's protocol is, offering grief counseling, making sure that the RA gets support too, that if they need more training around how to handle situations like this, or even managing a lot of the hearsay that will probably happen on a college campus, being able to set boundaries with the roommate. It sounds like the roommate might have had good intentions for reaching out to the RA, but we want to make sure that the roommate's not going around and telling everyone these details.
Amen.
And how the RA might be feeling. So they might be shocked depending on their own personal experience. If they've known anyone in the past who had passed away this way or not, this might be the first time that they're hearing of someone who had died by suicide, and being nervous about the right thing to do, not knowing exactly what to do next, remembering that they're only a student as well, so making sure that they're not carrying a big burden here.
Great, good.
Yeah.
Yeah, again, you guys hit it out of the park. You made a comment as a part of your group that it's okay, being sure that you meet the family's wishes. Schools can pretty quickly after being having an untimely death reported, that they can reach out to the school community and say that it's been an untimely death, so and so passed. When we have more information, we'll share it with you when it's available. Best way to handle something like that. And you hit it on is we now, if you remember, the most impact is the immediate family, but there are other groups in this individual's life that are also impacted by suicide and are also potentially suicide risk for themselves. So your comments and suggestions and reach outs and stuff are right on. So thanks for that. Let's move on. The luncheonette owner. This is my favorite.
That's Jeff. And I'm just going to say we have 6 more report outs, so we're going to really try to make sure they stick to 2 minutes each so that we get time back in the other groups. All right, Jeff.
Hey, I am the owner of a local donut and luncheonette shop. Joe comes in each morning for his coffee for himself and donuts for his office. I heard something happened to Joe as soon as I opened the shop on Monday morning. Joe has been a regular since he opened his practice 10 years ago. He is well known and well liked. When he arrives each morning, we shout, "A cup of Joe for Dr. Joe." This loss has me rattled. I don't know what to say and to all of the regulars and my staff, but I will give everyone a free cup of coffee to honor Joe. I will not let anyone sit at his usual table and put his picture and flowers on a special table for Joe. We honestly weren't sure who to reach out and contact, because just knowing Joe and having him come into our establishment, there's no guarantee we would have ever met his wife or his kids or even known that they existed. So we really didn't know who to reach out to in that aspect. As far as the things that we needed to do, we felt that we needed to keep our eyes open for people who may have been be exhibiting signs of depression, or people who seem to be struggling or just overly sad, to reach out and talk to them, try to make sure that they're okay. And we also felt that we needed to do something, but there was a lot of confusion as to what that something should be. We know that we're dealing with shock and surprise, and we're second guessing ourselves, wondering if we should have seen signs of maybe he said something we just didn't pick up on, or we weren't listening hard enough. But I think overall, just from our interactions with him, we do feel the loss, and it's kind of unexplainable. We don't really know where to go from here. We don't know how we should act, who we should talk to, and what we're supposed to do next.
Great, Jeff. Yeah, again, you guys hit it right at again. Another hitting out of the ballpark. The key thing here is you don't know, and as your group talked about, and the frustration, you know, the sadness and the hurt and all of those things that happen, and then what to do. Very normal, very certainly expected, and the fact that the luncheon owner didn't allow for any memorializations or any kind of special things outside what you would normally do if somebody else had passed away on an untimely basis. So, you know, we learned about that on Friday. You got to be really very careful with that, the sensationalization of it. So right on, you guys did well. Let's go to the next group. Minister.
That's Megan.
Yes, so the minister. I am the minister for the Williams family. I was called by Sarah Williams to come to the house shortly after she left services this morning. I arrived at the house and the scene was very chaotic. Police vehicles, a fire truck, a medical examiner van, people on the street, and the neighbors looking out of their windows. I suddenly realized that Joe's death was a suicide. I am beginning to understand the depth and the magnitude of his death will have on his family and the entire community. I am starting to doubt myself. I am having trouble understanding how this man, so revered by the community, a family man and a doctor, could do this. And so the first question we thought about who to contact. We were thinking about reaching out to Sarah and really asking her who she would like us to contact, and helping her, you know, figure that out. We were thinking immediate family, and then immediate people like in his everyday life. Then one or two things that we thought we would do were helping her figure out kind of arrangements that she would like to do, realizing it doesn't have to happen tomorrow, but asking her if there's somebody that she wants us to work with instead of working with her to set up things. And then the third part, realizing that, you know, most ministers or priests, pastors are usually very connected to the family. And so this is going to be a big deal for that minister. And so making sure that that minister is checking their own mental well-being and making sure that they're able to have some grief counseling as well. And that, you know, that they have their own support. And I think that was it.
Perfect, Megan. Yeah, again, excellent work, group. Yeah, and you know, as you can see, the minister blame, you know, many times, especially somebody that's really close to the family, and then this untimely death occurs. The first thing is blame, and as you can see, read in this scenario that he was doubting himself, and so I think you know, being able to point that energy in a positive direction is really key to not only helping the minister, but also helping the family. So good work. Superintendent of Schools.
That is Christine.
Okay. I am the superintendent of school. I am also a close friend of the family. I was called by Sarah Williams to come to the house. I arrived at the house at the same time as the funeral director, and I realized that Joe's death was a suicide. I'm beginning to understand the depth and magnitude his death would have on the family and the entire community, including the school. Sarah has been the PTO president since Suzanne, who is now in college, was a student in the public school. I need to contact my various school administrators to organize a school response for both staff and students. I'm acutely aware of how difficult this will be with the upcoming holiday. So initially, our outreach would be to our administrators, mental health teams, and special education with respect to at-risk kids, PTO administrators, town government, so that recreation, human services, EMS, and police can be engaged as the kids were involved with various town activities, community coalitions and community support groups, and then the community at large. We discussed that engaging the family on what.
Oops.
kind of response they would want, response from there, including, you know, as little or as many, or just any level of detail that the family was comfortable with. The guided response would also include potential social media and a press release with clarifying information, so that papers running the stories would have just something clear and clarifying to go on. Of course, if the family was in support of that.
Very good.
We also, a big highlight was that the superintendent, because of his personal relationship with the family, obvious feelings of guilt and shame, potential comparison, that in his response, even if the family didn't want, even if the family wanted to be completely private about it, that he or she would still need to produce a response, but that in that response, he or she would include their own self-care and what that looks like and what it could potentially look like for other people struggling in the community, so that he brings in not only his professional expertise, but also his humanity.
Great, Christine. Great, Christine. That's good. We're going to keep moving here, but
sorry, yeah.
I think you hit it up, and it kind of sounded to me that there's already kind of a post-pension plan being executed based on your group saying. But again, if you're in shock and you don't have that plan in place, how could you respond? What would you respond? Especially as close as the superintendent was. Good work, group. Let's go on to the next one, office manager.
All right. So I'm Joe's office manager at his practice. My son has informed me that Joe died. He saw it on Facebook. I've only been with the practice for 3 years, but Joe has been here for over 10 years. So I'm very concerned about how his death will affect patients and staff, since everyone respected and liked him. I'm not sure how or what to tell anyone at the office. I don't know whether I should open the office on Monday or if I should tell everyone. Maybe it's not my business. So a large piece of what our group talked about was really stemming from communication. So is the office manager the person to communicate with the family, or is there a partner who is in contact with the family? How does that trickle down to staff? How do they know? Is the office open on Monday for business, or is this an opportunity to bring in a mental health counselor or EAP to do some work with staff? And then obviously then, the trickle down effect of how is it communicated to partners, whether they be hospitals or other doctors who refer. And then obviously the largest piece is really having a definite plan for if someone from the press were to call, or really having a detailed strategy for how it's communicated back out to patients was a large piece of what we talked about in our group.
Great, thank you, Danique. Again, I think you're so right about communication, and I think that falls back to the school scenario, with the dorm and resident director and such, is communicating that there's been an untimely death is really important. Meeting the needs of the and satisfaction of the family, because there certainly would be some folks at risk here, obviously, if there was a death. So thank you for that. Great work. And now the landscaper.
It's Gillian.
Hello. Hi, everybody. Thank you. So we believe our character is probably one of the more vulnerable characters in this scenario. The landscaper is invisible. I am the landscaper in town and have landscaped both the Williams home and offices for many years. My neighbor told me about Joe's suicide death. My best friend killed himself at the beginning of the year, and I'm still in shock. I also heard that a local farmer killed himself this past summer. Then I suddenly remembered that a man from my neighborhood who snowplows for many residents also killed himself last fall. I wonder how this affected Joe, since this man plowed their driveway and office for many years. My high school son helps me sometimes, and I know that he knows Joe's son from school. So who do I contact? Well, those that I, landscaper, already knew. We think that first group is people that have already been affected by suicide, people that he knows, like the local farmer and the best friend's family and the snowplow guy's family. They are going to be triggered from this, and they are at risk. We think that a good social support network is really important to find. Perhaps write a letter to the family saying that I am a survivor of suicide and I am here for you if you need anybody to lean on. And they're feeling, obviously, a lot of shock right now. So very important to keep the open line of communication also with the son, who is friends with the doc's son. And then hopefully we have a therapist and we can reach out to that therapist and get the help that we need right away. What do you need to do next? Grief counseling, take a day or two off to grieve, talk about it, talk through it with close support network and trusted friends. Take the time to digest, since this is not the first suicide that we've experienced in a very short amount of time, and hopefully reach out to the family, maybe write a letter, that kind of thing. We are at suicide risk right now ourselves because we are so triggered. How are we coping? We are devastated, lonely, vulnerable, triggered, thinking this could possibly be a pattern in town because I, the landscaper, have just, it's unimaginable, but it's obviously even bigger in my life now with so many close people that I know dying from suicide. So wondering if it's a contagion. I lost my best friend only 6 months before, and again, really important to make sure that I stay in contact with a good network and talk about this.
Great, Gillian. Great report. Great work, group. Yeah, I think you guys hit it out of the ballpark too. It's just, you know, suicide's complicated, and it can affect a lot of parts of the community, and especially the landscaper. Who would have thought? Who would have knew that would be at risk too? So great report, thank you. And I think this is the last one. Local newspaper.
And this one, yeah, Rainey, great, thanks.
Yeah, I'm going to take this over. We had some technical mic difficulties. Yeah, so I'm the reporter, and my bracket is Contagion. I'm a newspaper reporter. The obituary for Joe Williams has been submitted to my newspaper by the funeral director, and my editor now wants me to write an article about his death. The obituary indicates that Joe died suddenly at home, but my editor tells me that she has heard it was a suicide and she would like me to cover it as a suicide. My deadline is Tuesday morning, and the police chief has not yet returned my calls concerning Joe's death. I am aware that covering suicide can be a sensitive subject to cover in print. I am quite unsure of how to proceed with this article. So when we discuss this in terms of who do you need to contact, right now all he has is hearsay, and he really can't write an article at this moment. He would want to cautiously contact the family to receive their permission to cover this death in the newspaper at all. And he would also want to definitely double check with the police and emergency personnel that what his editor has heard is actually true. He does not seem to know Joe personally, so he has really nothing to go on. And what are the one or two things he needs to do next? He needs to verify his facts, and he needs to make sure that he knows ethical ways to cover suicide in print. I know there's guidelines to follow and wording to use, so he needs to do that. In terms of how he's feeling coping, he seems to be, you know, looking at this very unemotional. At the moment, he does know, you know, academically that it's a sensitive subject, but he doesn't seem to be so too faced by it because he has no personal connection. But I would certainly feel unsure because I want to do what my editor has told me to do, but I would also want to do the right thing, or he would want to do the right thing. So that seems to be, trying to figure out what's the best way to go forward. And he seems to have some sort of, conscious gnawing at him there. So
Right.
that's our report.
You guys covered it as well. Very, very good. And we spoke on Friday that, controlling the communication is so important. And, and very, very, very often somebody who dies by suicide, family decides not to be open about it the right way. And so being conscious of that and going to get the information to how best handle reporting a suicide, given the family's wishes, is certainly something that we need to help media understand and editors and all that stuff as we report. So that's the last scenario, and we're at about 10 more minutes to the half hour, and we started 15 minutes late, so apologize to you all. We're going to break you up into groups again. Please stay in as long as you can, and we'll do a quick wrap up afterwards. But I want you to leave now with thinking, if you can't stay and you have to leave, that now that you've listened to all of the other scenarios, what would you do differently with your particular person that you spoke to in your group? What would you change? How would you change it? Would you do anything differently? And then what would you do 3, 6, 12 months as the personality that your group was assigned them? What would you do in the future to help not only to care for yourself, but to care for the family and the community around? So unless you want to add anything more, Margaret,
I was just going to say, I'm going to reopen the rooms. You'll be back with the same group. The rooms will close in 15 minutes. Like Tom said, if you have to go, you have to go. And Tom, maybe we really just open on Wednesday with some of the wrap-up conversation, because I know there's stuff in the chat. People want to talk about social media and some of these things.
Okay. Let's do that.
Right? All right.
We can do that. Yeah.
So then why don't we just assume that Tom and I will still be in the main room if you want to exit the breakout room to talk to us. Otherwise, stay in your breakout room until as long as you can. And when it closes, we'll just see you Wednesday.
Okay.
All right. Thanks, guys.
Thank you, guys.
Tom, it looks like that part was pretty easy, to just reopen the rooms everyone went in. Tom, are you there?
Yep.
All right. I didn't know if you needed a potty break.
I just did. Honesty's the policy.
So that part, technologically, that part worked fine. Like if you reopen the rooms and you don't reconstitute them, they go back in. What I'm going to do is email everyone, after we're done, I'm going to email them all the documents that we wanted to send them today. And I'm also going to say to them, if you have a Zoom account, which is free, log in with that, because then apparently that's what the big issue is with them going into the pre-assigned rooms. But I can tell you you can't see the chat, or you can?
Yep, I can see it.
Okay, so you saw there were questions about social media and questions about the flowers on the table. And is that sensationalizing or not? And how long would you leave them there so that it's time limited? It's funny because when I saw that, I was like, I literally remember that same conversation coming up in the group in Cromwell. I think people want like a hard and fast answer. They were like, wait, don't just say this could be dangerous, do it right. Like exactly what's the right answer? And that's going to be tough because there's not always a perfect answer, right?
Yep. Well, and the luncheonette owner, you know, and how long would you, you know, would you do that? Would you do the same thing if there was a car accident, one of your customers died car accident? Would you do that the same thing if somebody just died of natural causes? See, that's where it gets tricky. And so we'll have a chance to talk about it. We have plenty of time on Wednesday.
Exactly. And you know, I do think that that's been sort of an argument that I've heard. I think that's the fine line that really does bear a lot of discussion, because I think, you know, if you had someone who came into your cafe every morning for years, you probably would put flowers on the table, no matter how they died. So you're not really, you're doing what feels natural to everyone. And if you didn't do something, people would be like, what the hell? How are we not recognizing this guy? And I feel like schools have had that same conversation. Like, how can we not acknowledge this person died? But then it's, you know, so it's like, where are your limits? Where are your boundaries? When does it become glorification or sensationalizing?
There's a fine line. There is a fine line.
Yeah.
It really is. I see Larry and Jennifer are still in the main group room. Were they able to get?
Oh, why is Jen still in the main group? I don't.
And then Ingrid just popped up. Now she disappeared. No, there's it.
You know what? They're probably exiting their groups. I bet they have to go.
Oh, okay.
I think that's what's happening. And unfortunately, Larry's speaker is not working. So I'm thinking he may have not gone back into the group just because speaker wasn't working.
Yeah. Okay. I think he's in a phone. Maybe he called in on the phone. On his phone. I'm not sure.
Yeah, and his phone is off, it says. So,
yeah.
Well, Larry, if you can hear us and if you wanted to talk, I'm going to unmute your phone in case you're able to talk if you wanted to.
Okay. I'm trying.
Hi. So sorry about your microphone. Yeah, I can hear you now. Did you call back in?
Oh yes. I just got through. I had to go out and get my phone out of the car from the parking lot, and I just got back. I'm on now.
Oh, wow.
I speak.
Do you want me to see if I can put you into one of the groups now then?
Yes, because I'm watching the group. Go ahead now. I can hear them. I just wasn't participating.
I'm trying to see if I can. Let me see if I can get you in there then. Hang on. Yeah, that's great because now we can hear you. And you were in the group with Riney, and I'm trying to see what number that ended up being. I think it ended up being.
That number.
Oh, room 9. It ended up being room 9. Okay, here you go. I think.
He's on the phone. He might not be able to do it.
Well, he actually, nope, it looks like yeah, it's funny. In participants, I still see him.
Yeah.
But nope, he is in room 9.
Okay, good.
Yep. Good, which somehow ended up being the smallest room right now. It must be the one that most people had to leave.
I think once we got started, I think it went well.
Yeah. So I think like the big takeaway here is, you know, well, there are the Zoom problems, and that's going to be tricky on Monday again, because if you have to manually assign people, you cannot manually assign them until they're on the call, right? And then it's like 3 to 4 clicks per person times like 89 people, right? But the other thing is that the idea that they'll take 2 minutes to report out, you know, they stayed close to that, but you know what we didn't build in is then like with you responding to them also, like we probably should assume that it's at least 3 minutes per group, right? Which means it's like a half hour right there. I'm looking at the clock. We did take a half hour for the report out. And that's reasonable, right? Because people need to think about it. So I think in terms of the assignment, we should just build that time into that first breakout group.
All right.
But yeah, so I'll probably type up these notes about like what to try another time for the breakout rooms, because I'm going to want to remember it myself whenever I have to do it. And if it helps you for when you do this with some other group. Oh, room 8 is closed out. I guess everybody must have left.
So you said you can download or print the chat room. How are you doing that?
It saves it automatically. If you're recording the meeting, it records 3 things for you. It records, they all do. As far as I can tell, they all do, because we use Ring Central a lot also. It records the audio visual, it records audio only, and then it records the chat. It might be an option I can turn on and off in Zoom, but it seems like the default is on. I think I did see where I could turn it off.
Okay.
And so just FYI, one of the things that everyone's supposed to know is if you think you're private chatting with someone, that's also recorded. Like the private chat just means everyone else isn't seeing it when you send it, but it's still going to print out if someone wants, or the people who run the meeting are still going to see what you said.
Gotcha.
Okay, I see. It seems like a lot of people are going to are getting off now because it is just after 11:30. Yeah, we have 2 rooms that have closed out.
This was interesting. I just I copied the Zoom chat room and I pasted it into a Word document, and it all came out.
Yeah, yep, and you can do that too.
I've had this big training on Thursday with the Demas folks, with the substance use, and I like the idea of having them, go in the chat room and introduce themselves, their name and where they come from, because I've got 30 plus people in each one of these trainings, and I have to take attendance. So
yeah,
that's how I'm going to do it.
Yeah, and so you can copy paste, or if you just record it, it'll save it right onto your, when you press that record button, everything that it saves goes into, it automatically saves to C Documents Zoom. So it creates a folder called Zoom under Documents on your hard drive. And then it creates a subfolder of Zoom with the name and date of today's meeting. And that's where you'll find all the documents.
Cool. All in all, I thought it went pretty well, other than, we making the damn thing work.
Yeah, I mean, I am frustrated because, I did all the research on Zoom. They're like, when you have a big group, just, I downloaded their spreadsheet. I put everything, I uploaded their spreadsheet. I confirmed, like, if you could see inside Zoom right now, you can literally go in Zoom and see a description of all the people in all 10 rooms. And it's all set up, but it doesn't work. Well, now I realize, I guess it probably doesn't work because they all had to log into a Zoom account.
Right.
But they don't tell you that.
No.
Yeah, I do think we don't know how they discussed in their rooms because we weren't in and out of them, other than me trying to problem solve a couple of them, but I'm sure the discussion was good.
Everybody coming back now?
let's see. Yeah, it says they have, the breakout rooms are 2 minutes and 13 seconds more. It gives me a little time on top.
Oh, good.
There's only one person left in one room, so they must be closing out. Yeah, only 2 rooms shut down. Well, one room has one person left, so that's basically shut down.
The way to do this in person is you break everybody up into the groups and then you have them move around. They read the scenario, they report back, then you have them go back into their groups to, you know, now that you've heard all the different scenarios, what would you do differently?
Yeah.
And what are your next steps? So, and that's the hard part of this. So.
And I noticed, you know, on the instructions, the first question is, who are you most worried about that's most vulnerable? And I thought it was interesting when Gillian reported out on the landscaper, she literally used those words. She said, we think this is probably one of the most vulnerable roles out there.
And it was designed that way. That was the one. Yeah, these scenarios, Faith Foswinkle and I worked on together with one of her graduate students, because we wanted what we went through with Connect. They were real bland. They were too generic or general. So we kind of wanted to put some meat on the bone, and then also put an emotion or a feeling connected to it.
Yeah.
So that the groups could have a little bit more insight. I don't know if I'm a big believer in that, but several of the groups talked and shared about it. So
talked and shared about what? Sorry.
The emotion that each one is, so next to each person there was an emotion.
Yeah. All right, so I'm closing the breakout rooms now because their time is up. It says it gives them 60 seconds to leave, so it's possible that some might come back to us. For any final comments?
Yeah, and Tyler, you can open up microphones if you want.
Okay. Yep, I unmuted everybody. Hi guys, we see some of you coming back, and you can hang out for a couple minutes if you want to ask any questions, and if not, you can feel free to leave and we will see you on Wednesday.
Margaret, we had a question come out of our group. I think we're a little unclear on kind of what's appropriate memorializing versus what might be risky. Specifically, say the diner owner who sets the booth aside with the flowers, like how long should that, you know, is there some guidelines as to how to memorialize an untimely death versus what would be perceived as, you know, encouraging, you know, or glorifying or encouraging copycats?
Exactly. And that's
let me jump in and make an attempt at that. You know, and the luncheonette or the, you know, the breakfast place guy was specifically written in for that purpose. So we're glad that you did.
Oh no.
Did connect to that. But the key, the key thing is.
You're getting it all over you.
Who's call talking? Come on now, don't ruin my thing here. No, it's all right. You don't want to separate suicide death out from any other death. So if that person died by natural causes, would you have reserved the table and put flowers out, or would you only do it because of the suicide? You want to treat all death the same. And when we work with school systems especially, that's important because that's where potential contagion can happen. So, so the best thing to do, and remember on Friday, it's about time. So if you're going to do something like that, maybe just the day, you know, or, you know, because of the shock of it all, you know, and then have folks talk about it. But, you know, some families don't want the public to know that their loved one died by suicide. So you got to respect that. So to me, the best rule of thumb is if you're, especially in the luncheonette owner, was, you know, treat it as you would any other passing of a patron that comes in. And, you know, and then if the conversation does go in the group about the untimely death and whether it was a suicide or not, the best way to handle it, as we've learned and we've seen in the discussions in all the groups are concerned, is it's not really rule of suicide until the chief medical examiner is around. So the best way to handle it and communicate it, it was an untimely death, and you know, and it certainly looks like it potentially be suicide. But our concern now is to care and make sure the family's taken care of, and loop in the family support and that kind of stuff. So it's about time, and so I think memorialization it's got to be done very carefully and within a distinct amount of time. When we talked on Friday, we talked about doing kind of forum type conversations, which there's some really good data now and feedback that those can work, but not immediately following the death. It might be a month later. And so you're not talking about a specific death, but you could be talking about suicide or mental health promotion issues as a broader conversation as opposed to a particular loss, to build capacity in the community. And those seem to have worked, especially if you know, I don't like more than 5 people on the panel, and 3 people is really the best, you know, the powers of 3, of professionals that understand about safe messaging and self-care and that kind of thing. And when you organize a thing like that, you can put a lot of safety people in place, a lot of professional people in place that can help just in case somebody is challenged. So it's a fine line, and it's hard to distinguish, but being not glorifying it, I think is the most important. Keep that in mind. I think would be good.
Thank you.
I don't know if Dana, I didn't see actually, is Dana Basio still here? Because she had a question about social media.
Is Dana up?
I'm unmuting, sorry. Yeah, I did. I just, you know, I think the boyfriend, it was a perfect example of how quickly information moves. And again, the intentions are good. You know, and I guess my question is how to kind of intervene when we're moving that fast, and what's the appropriate thing to do. You know, I'm thinking about it from a school district perspective. Obviously we would, you know, send messaging out to staff that would ask them to, you know, again, keep conversations private. If they have questions, this is the person you should contact, and sort of warn them against the pitfalls of using social media. But in terms of kids, how do you do that? What do you say?
Yeah, when I've worked with school systems, I think it's really important that when there's an untimely death, and whatever your school system's protocols is, that it needs to be really tight and on a 5x8 index card. Step 1, step 2, step 3, because it's really important. If you've done your suicide prevention, postvention, and grief support training in your school system, and you have those protocols in writing, that you put it on one small piece of paper, one card, laminated, whatever. So when something like that occurs, they can either pull it out of the computer or they have the resource card on what to do and how to present and how to share and that kind of thing. Mm-hmm. I think it's great. It just you know, with faculty, they got so much other stuff that they're dealing with that having that support from their administration to say, okay, we're going to put our protocols in place based on our plan, and here are some key bullet point things that they need to know. Best way to handle it. And social media, you know, when you build your postvention committee, you got to find a good social media person. The best ones that I've worked with are safety officers, school safety officers. that are really good at it. And so if you have a member of your team that's a school safety officer, or maybe was one and has now been reassigned, because I know police departments, school systems do that every other year. That's a perfect person to monitor the social media and then put in posts that are clarifying and have all the right safety messages. And unfortunately, police officers had to learn how to handle social media, and they know how to, remove stuff to protect the community, and they're allowed to do that. So that would be my suggestion. And the social media is a tough one, and I think why educating our kids about how to use social media in advance of anything like this happening. It's just like suicide death. I've seen some things here in the past year connected to race that has gone way out of control. And before the molehills turned into a mountain, and now you got not only kids at school upset, but you got a community at large at school. So being forthcoming, and don't be afraid to train your high school kids in QPR and all of the training that QPR offers for those kids, or some sort of suicide prevention program that addresses social media and how to be safe. And a lot of that stuff with the bullying laws, the 2009 bullying law here in the state, addresses a lot of that, but maybe not necessarily suicide. So being sure we have open conversations with the kids, and so that they have the tools to best keep themselves safe. And then if we need to, we can, I don't like the word intervene, but we can act on our end to keep them safe.
And we're in the midst of revising our suicide prevention policy in district. So I feel like the social media piece needs to be its own section. Like, I feel like that needs to be a really explicit part of that. I guess my question is, in the immediate sort of aftermath of a suicide, would we be as explicit in our communication with families, with students? If you're in need of support, here's X, Y, and Z. The family is maybe experiencing some things. And even if we're talking about an untimely death, let's say we're not, sort of enumerating that it was a suicide. Could we sort of include a statement that would warn against the pitfalls of using social media and say, this is where you should go if you have questions or if you need to talk? Is that okay?
Yeah, great, because that's what we're going to learn on Wednesday.
Okay,
good. just how to communicate that out. Yeah, there are ways you can do that. Especially with a school system, an organization, or community, you can direct social media to a place of information, and that's the rule of thumb. So you've had an untimely death, and you don't want to get out of control. So what you do is you say, and many times it's a person on your suicide postvention team or committee who handles it. Or in a school, it might be assistant superintendent, and I know several school systems that work hand in hand with their superintendent to be sure that, so that information's coming out of one place. So, and you put it right in your social media, in your communication. If you have any questions, this is the official place to get it, not any other place. I'll share a personal that directly connects to this, and I'm making a little ahead of myself. But after my son died by suicide, somebody set up a Facebook page that was not nice and not good, and saying a lot of not very nice things about Tyler and about his family. And it pissed me off. Let me tell you, I was mad. But and we didn't know, but we just thought it through. And my other two sons, they got on social media. We set up a separate page. This is the official page for all the information. And then on the page, though it was still there, went away. And then my kids went in and started posting on that unofficial page, every day, saying, this is not the official place. You really want to contact me directly, or contact, or contact, and I can't remember, it was a family friend was handling a lot of our communication after Tyler passed. So that's how you do it. It's the way to do it. And it can be very hurtful for families, you guys. I can't tell you. I mean, I still carry scars from the few days after because of rumors and innuendos and all the things that get spread out all over the place. And you sit there and say, where is this coming from? And it happens. And that's what happens when media goes out of control, or whether it's a suicide or whether it's any other untimely death or overdose. I know some families here in Connecticut really struggle with that because, a well-kept hidden addiction is now out. And how does it relate to family and to other people? So it can be really difficult. So controlling it and having official communication points and having people monitor it. And so when things start to get out of hand, folks can jump right into those pages or onto those social media and take some action so that wrong information doesn't get spread.
And Tom, how horrible to think that happened to your family after you were already dealing with Tyler's death. So I'm really sorry. And you're not the only person I've heard experience that. It's just unbelievable how shitty people can be sometimes. I'm really sorry.
My other two sons, when they tell their Tyler story, they talk about that in a very, very emotional place. And they're adults now. And they all took different journeys to heal from their brother's death. But when they talk about it, they just, how hurtful that was to them. And so me, I'm very proud of all three of my kids. I'm proud of, but more importantly, Ryan and Corey, because they really took definitive action. They were strong. They were not going to let that get out of control. But they have scars because of it now. Yeah. Any other questions? I thought the group reports were really good. Sorry, we're kind of trying to move people along, being sensitive to time. So I hope no one took it negative or anything. We just really wanted to get through so every group could report back.
For those who are still here, because it looks like we still have 20 people, I put this in the chat. It appears that the reason that the breakout rooms didn't work automatically after I uploaded the spreadsheet is that everyone's supposed to log into Zoom and then it will automatically put you in your breakout room. So on Wednesday, if you have a Zoom account and they are free and you log in that way, it may facilitate going into the breakout rooms, because I am going to try to, again, I'm going to try to pre-assign the group so everyone will be working with your town team. But for people who don't log in, I am going to have to manually assign everyone after you get on, and it's like a few seconds for each person. So it's going to happen again, probably.
But now we know it, so we can be prepared for the inevitable if it should occur.
Yeah, I won't be experimenting anymore with trying to make it work, because it doesn't work.
And and Wednesday's training is, I'd be surprised if we take all 90 minutes, because really it's the conversation. I have about 10, 15 minutes worth of pearls of wisdom to share with you as you begin to build your plan. And then I'll let you break out. And we'll give you a good half an hour to really have the conversations, begin to write things in paper. We're going to send you a kind of a bullet point, graph sheet that you can print out and put on your computer to use to help you guide through putting really a framework together first. Then you put you connect the words to it. And Margaret will share, I have several different suicide prevention, postvention plans from different sectors of the communities that you can use to look at, and kind of use it as kind of a template, if you will. Why reinvent the wheel on? So I'm a big believer in. But suicide prevention and postvention plans are very community specific. So that's why we don't give you an actual, boilerplate. Here you go. Change the names and put it through, because it just doesn't work that way. You got to have the community conversation with the 12 community sectors so that everybody is, attached to the same wire when it comes to the subject.
All right. Well, you guys, thank you so much for your time today. And Tom, thanks again. And any facilitators are still on the phone. I see Christine, yes, and Gillian. Thank you guys very much for your role in this. And we will see you all on Wednesday at 10.
Thank you, everybody. Wash your hands.
Bye.